welcome back to our smoking cessation series. This is video number 4. My name is Amanda Eddy, and I work here at Community Clinic with the Northwest Arkansas Tobacco and Drug Free Coalition. I work a Tobacco Prevention Cessation Program grant.
Yeah, I'm Abby Lucius. I'm the Community Development Manager here at Community Clinic, and Amanda and I are both certified tobacco treatment specialists with many years of treatment under our belts, and so we are really excited to get to talk about today's topic.
Yeah, absolutely. So today we're going to be talking about different nicotine replacement therapy options. What are some that work the best? How can they work together? We're going to break down some common misconceptions that we see a lot when it comes to certain nicotine replacement therapies as well, and kind of go into detail about what may work best for you. Now, obviously, this is a conversation that needs to happen with your healthcare provider and your pharmacist, and what if we're talking about sort of medication and anything like that. So please be sure to have that conversation with them. But Abby's going to talk a little bit more about the different therapies, and we'll kind of go into some myth busting as well.
Yeah. So I think the best place to start off is probably with over-the-counter nicotine replacement therapies. That's probably what most people are familiar with. So these can be done as monotherapies, so you can use one of these options by itself, or they can be used in combination therapy, so you can use them together, like patches and lozenges together. Probably you're familiar with the patch. If not, the nicotine patch is a transdermal patch, so it sticks to your skin. You can put it on lots of different places on your body, your arms, your shoulder, your chest. Trying to keep it on your torso is really important. Sometimes people like to wear them lower on their lower back, like where their belt hits. One thing that's important to keep in mind with the patch is if you are a worker who's outside sweating a lot, sometimes wearing it down lower where it's protected by your pants and your belt will keep it from slipping off. But those patches are really great. You wear them for 24 hours. They give you a slow release of nicotine throughout the day. They're wonderful for people who are avid tobacco users who typically are reaching for their pack of cigarettes multiple times in a day, because that can really sustain any major cravings. It can't really address if there's initial triggers that might set you off, but it's great to start off the day, put that on. It takes about 2 hours for it to get into your system, so we always want to be really routine about wearing our patch if we do that. The transdermal nicotine patch comes in 3 doses, 7 milligrams, 14 milligrams, and 21 milligrams. Those milligrams are relatively correspondent to the amount of milligrams of nicotine you're taking in a day. So it's really important to read the box, talk to your pharmacist, talk to your provider or a certified tobacco treatment specialist about what is the appropriate dose for you to start at with your patch. And they're meant to be used in a process called titration, so you work down as you're on your journey to quitting smoking. The reason I mentioned combination therapy is because there's also nicotine gum and lozenges. And for any of you old school smokers, you might be really familiar with these and think they are disgusting and don't taste good. But these products have changed over the years, so they now have much better coatings on them to make them more tolerable and tasty when you're using them. And these work really great in moments of experiencing triggers or when you are just dying for a cigarette right that second. That nicotine absorbs in your mouth, in the mucosal membrane of your mouth, and so it hits your bloodstream so much faster. So it's really great to keep those on hand, and you can still wear your patch, but keep some gum in your pocket all the time, and you can just pop one whenever you're feeling like you really need a cigarette. So those options are available at like every Walmart, every Walgreens, any place where you would go and pick up a bottle of Tylenol, you'll probably be able to find different nicotine replacement options.
For sure. And it's important to note with the nicotine patch as well, anything that goes on your skin, there can be potential for irritation. That is something that some patients do experience, and so they do recommend, and your doctor can talk about this a little bit, moving the patch in different areas so it's not always on the same area, because that can cause some really severe irritation for your skin.
Definitely. And that doesn't mean that you're having a bad reaction
Yes,
to the
that's
nicotine.
the myth too.
A lot of the times people think, oh, I can't use that patch, I got itchy bumps.
Mm-hmm.
Well, if you think about it, like if you had a Band-Aid on for 24 hours and then took it off and put a new Band-Aid on in the exact right spot, your skin is going to get weepy, it's going to get irritated. That's a typical reaction of the human skin. And of course, when you're absorbing a type of, say, medication or something through that patch, it's likely that your skin will have some type of reaction to it. So Amanda's exactly right. We need to keep moving it. Every day when you put it on in a new spot.
Yeah, so the gum and the lozenge are really great, especially if you're a chewing tobacco user, because you're getting that same sort of mouth-like stimulation is what they call it, right? A lot of people that use chewing tobacco, when they put it in their mouth, the saliva builds up, and they're so used to having that sort of sensation. So if you do utilize chewing tobacco, that's the one that may be the most impactful on you in terms of helping you get that nicotine replacement. So that's kind of something to note. But Abby was completely right too, with the combination therapy is so essential for a lot of people. Continuously be on that patch, and then if it's really, really bad, especially in the mornings for a lot of people, as we've mentioned in previous videos, that first morning cigarette is kind of the one that everyone craves. And so at that point, maybe getting a lozenge or chewing some gum may help kind of alleviate that.
Definitely. And another reaction that we see from some people is saying that they can't use the gum or the lozenge because it makes them nauseous or it makes their stomach irritated. And as I mentioned before, the nicotine is absorbed through your mouth. It can't be absorbed in your stomach. Your stomach cannot break that down and metabolize it. And so very frequently, if you're chewing the gum and making a lot of saliva, you will most often swallow your spit. That's what everybody does. But it can really upset your stomach if you're absorbing if you're swallowing some of that nicotine. And it can make you burp. It can make you nauseous. It might make you throw up. If that's the case, you need to reevaluate when you're using that. For dip users, it's super easy. They're so used to spitting anyway that they can do that. And sometimes it's not as, if you're a woman, not as ladylike to be spitting in public or during a pandemic to ever be spitting. But if you can keep a water bottle with you, something that you can keep spitting out if you're making a ton of saliva, that's important. Mm-hmm. And on the same note of a water bottle, try not to eat or drink a few minutes before or after you use those products. Pharmacotherapy is another wing of tobacco treatment. So this is something that you will definitely want to speak to your provider about. A lot of the times when folks have either tried all of the over-the-counter options and they're still facing some difficulties in quitting, this is a really good time to talk to your provider. Or say you are really committed and you are ready to, quit as fast as you can. You might want to have this conversation with your provider and start with the pharmacotherapy options instead of the over-the-counter options. It's really, everybody's journey is different, and it's just a conversation to have with your medical provider. But there are a number of different options. Chantix is one that probably most people are familiar with. Its medical name, I guess, is what you would call it, varenicline. So you've probably seen commercials for it. You might have heard a number of different myths about Chantix. And just like any medication, it's really important to keep in mind that everybody handles medications differently. Mm-hmm. And so it's no different when we're talking about varenicline. So Amanda, do you want to tell us some of the myths that are really common with Chantix or varenicline?
Yeah, absolutely. So as Abby mentioned, taking medications, that's something that you really have to have a good conversation with your healthcare provider and your pharmacist. But there are some myths that surround these medications. Chantix is an extremely effective medication for helping people to quit smoking, and a lot of people have quit smoking utilizing it. There's this sort of misconception about it that it causes people to suffer from mental health issues such as, suicidal thoughts, hallucinations, other sorts of mood disorders. But there was a study conducted called the EAGLE study, and basically what that study concluded was that Chantix did not cause those issues in a majority of people, and even people that already had mental health issues in the past did not experience those side effects. But if you have an untreated mental health disorder, it can cause those to be amplified. So that's kind of something important to know when it comes to Chantix. And utilizing any of these medications can cause certain side effects, but the
Yes.
effectiveness of them are some of the most powerful for
Definitely.
helping people quit.
And certainly, like any of the side effects that Amanda mentioned, if you were taking this drug and ever started to experience anything that just didn't seem right or was out of the norm for you, you always have the option to call your medical provider immediately. But I did want to talk about how the drug itself actually works and how it's ideally administered for someone who is trying to quit using tobacco. So just like I mentioned earlier about the titration process of nicotine replacement therapies like the patch where you dose downwards as you're quitting, the same goes for varenicline, only the opposite. So you dose upwards as you're quitting. You start out at a relatively low dose of this drug, and that's for the first 8 days, I believe. In that time is a really great opportunity for you to be working on all of those goal setting techniques like we've talked about in earlier videos. Getting your house cleaned up, collecting all of those cigarettes, ashtrays, lighters, cans of dip, whatever it might be, and getting those triggers out of the way so that on day 8, when you start to dose up on your varenicline, you can actually go tobacco free starting that day. This drug will then block nicotine receptors within your brain and throughout your body to help reduce those cravings and to stimulate the different parts of your brain that are needed for you to effectively quit. So some side effects that people might experience, just like with any drug, you can have some nausea, possibly vomiting. And so you would want to address when you're taking this drug throughout the day. Make sure you're drinking plenty of water when you're taking it. And then make sure you're taking it with food. You might experience some vivid dreams. And honestly, that's a really common side effect with anyone quitting smoking. The body or the brain is really fascinating in how it adapts and reacts when we deprive it from different chemicals that we have been giving ourselves for many, many, many years. And so there's a lot of different side effects that you might experience, and your healthcare provider can talk to you about that more. But one of the really important things that you'll see is those cravings should really be diminished relatively quickly. Ideally, you're going to be on this drug for 3 months max. However, I've had experiences with multiple patients who have just felt more comfortable staying on it a little bit longer. And again, that is a conversation for your provider, your healthcare provider. So the other drug that I wanted to mention is bupropion or Wellbutrin. This drug you might be familiar with as an antidepressant or anti-anxiety medication, and it works wonderfully for treating those disorders, of course, but it has also been discovered to help those who are using tobacco products. These drugs are really effective for people who already have some underlying depressive issues or anxiety issues, to treat those in addition to helping with nicotine withdrawal symptoms. Because a lot of the times those things really do go hand in hand, just like our addiction is triggered a lot by our mental health and our state of mind. This drug kind of helps to balance that out.
Yeah, and if any other drug that you take, there's always going to be certain symptoms or other issues that you could experience, especially with any drugs that treat anxiety or depression. For some people, that can have adverse effects, and so that's, again, a conversation you need to have with your healthcare provider or pharmacist. And if you are experiencing any severe mental health issues, such as suicidal thoughts or ideation or anything like that, taking any of these medication, consult your doctor right away with that. And that goes with any medication. So that's an important thing to know.
Yeah. And then the final drug that I wanted to mention is called the Nicotrol inhaler. This is a very effective tool as well. I think this is a really important topic to bring up because with calling it an inhaler, I think there can be some misconceptions when we think about some of the products that are on the market right now, vapes and e-cigarettes and things like that. And also if you're thinking it's like an albuterol inhaler or something that you would take for asthma, all of those are really common misconceptions. This is a very different product. It comes in a small cartridge, a little bit smaller than the length of a cigarette, but similar weight and width. So it's very comfortable for someone who is a smoker to transition to this. It comes with different disposable cartridges that you get of pharmaceutical grade nicotine. The flavor of it is much like menthol flavored cigarettes, and so we do get some complaints from certain users that are, avid Marlboro smokers and really don't like the taste of menthol. But it is something that you can slowly transition to and get used to. This does not come in different doses, so you have to really self-pace yourself when you're using it to make sure that you don't make yourself sick by getting too much nicotine from it. It's just really great for that hand-to-mouth fixation that many people who are regular smokers can have. And it's really important for that as well. You inhale that and it absorbs inside your mouth, not inside your lungs. So we have a lot of people who are used to taking big, long, strong drags off of their cigarette, and they try to do the exact same thing with their inhaler, and they'll find that that can make them very nauseous or not feel very well right after doing that. And that's because you're absorbing a ton of nicotine right into your mouth when you do that. If this is a product for you, and your provider agrees that that's a great option for you, that's something that you want to be cognizant of when you're getting started on it. And this is something that you do need a prescription for. It can be relatively expensive, I do recall that. But the website that manufactures this product does offer coupons, so I do know that is an option as well. Do you have any other additions for this product? I know it has been very popular amongst people that have tried it, but I know providers might not always remember that this is a really good option, so I always implore people to bring that up.
Yeah, for sure. There's so many different options that you can utilize to help you to quit smoking. And these are just some of the main ones that we discussed, and they're coming up with kind of new stuff every single day. But this is definitely a good conversation to have with your healthcare provider, as we mentioned earlier, to kind of figure out what the best dosage needs to be and sort of what to start you off on. It's a hard journey, but for a lot of people, it's really worth it. And we've talked about that in our previous videos, just those benefits of quitting.
Yeah. So certainly today's conversation was not meant to be providing any kind of medical advice to anyone, but it is to better educate you when you start the conversation with your medical provider, or maybe bringing it up to a pharmacist that you're wanting to use some nicotine patches. What's the best dose for you? There are some other services available. Do you want to talk about the Quit line and being able to talk to a tobacco treatment specialist there?
Yeah, for sure. So in the state of Arkansas, we have a program called Be Well Arkansas, and you can visit www.bewellarkansas.org. Our 1-800-QUIT-NOW is still a line that you can utilize here in Arkansas, and so it redirects and reroutes you to Little Rock when you call in. And these are trained specialists that help people deal with quitting smoking, and they can provide opportunities and access to nicotine replacement therapies if you can't access those for your health insurance. So it's a really great resource here in Arkansas, and we can kind of link it down below as well so you can have access to that. Yeah. So that's a really great resource here that we have in the state.
Absolutely. Well, thank you so much for joining us today.
Yeah.
Stay tuned. Next week, we'll be talking more about maintenance and relapse prevention for those individuals who have made it a little bit further on their journey and have been successfully able to quit, but want to make sure they stay quit. Please tune back in. Follow us at C Clinic NWA and
at NWA TDFC. So that's where you can kind of find us as well. So we'd be happy to answer any questions or offer any support that we can offer. So thanks, you guys.
Thanks.